Let's talk about laser hair removal. Now, a lot of people don't look at this as a medical procedure. It's something that spas do and things of that nature. But here at P. Frank MD, we still consider it a form of laser surgery. It has come a long way. We still wish we'd had some more. Here are some simple tips. Number one, we cannot treat gray hair. We cannot treat very thin blonde hair. The technology hasn't come about yet. It's not coming anytime soon, so forget about it. The ideal patients are patients where you can detect the contrast, which is lighter skin and darker hair. And although there are several lasers that can be used for darker skin types, the ideal candidate is always when the hair is relatively dark and thick compared to the natural skin tone. Now, it is very important that you go to a place that has multiple lasers, because there is no laser that treats all skin types and does it effectively. Here we use various different wavelengths of energy to achieve what we want. We pick the right technology for the right patient. Another thing, there is no laser that will be a one and done because of the way the hair growth cycle works. We don't grow hair and shed it like animals do. We grow it in stages, so it's important you go for monthly treatments. Depending on the hair thickness, the skin type, and various medical issues, it could take anywhere from 4 to 6 treatments to get really 80 to 90% of that hair growth gone. But it is important, the timing, every 4 to 6 weeks. If you go 2 or 3 times monthly and you think it's good, it's not growing back, it will come back to haunt you. You cannot spread out the treatments. It's also important to not pluck the hair in between treatments. What you're doing is you're targeting the pigment in the hair follicle. So you can dermaplane, you can do the shaving thing. A lot of people don't like that. But you really want to keep that hair root in the follicle so the laser can appropriately target it. Lasers have been advanced even in the last few years. They're safe, they're very quick. You shouldn't need topical anesthesia. You could use technology that even does legs or backs in as little as 15 minutes. So wherever you go, make sure they have the most up-to-date technology. Make sure they have several technologies depending on the right target audience and skin type. And make sure they give you the appropriate skincare instructions, like don't be tan afterwards. Don't go to the sun right afterwards. Don't plunk. Simple things that will give you a great and predictable response. This is still a medical laser procedure, and it's always the best to seek professional healthcare specialists for it.